Hello, Golden Vitality family. Ever wondered what doctors, psychologists, and aging specialists really think about masturbation after 60? In today's video, we'll break down the expert facts on how it affects your senior health, from stress relief to sleep to prostate care and when to be mindful. Stay tuned, this truth might surprise you. Hello and a very warm, sincere welcome to you from all of us here at Golden Vitality. We're truly glad you're choosing to spend some time with us today. Here, we cherish the journey of aging, viewing our 60s, 70s, 80s, and beyond as a time rich with wisdom, experience, and countless opportunities for continued well-being, connection, and personal fulfillment. Part of embracing this journey fully involves feeling comfortable and empowered with knowledge about all aspects of our health: physical, mental, and emotional. Sometimes this means exploring topics that might feel personal, private, or perhaps weren't often discussed in years past. Today, we want to gently delve into one such topic: masturbation in later life, specifically looking at experts' views on masturbation for the elderly. Our aim is to share information based on the current understanding within the medical, psychological, and geriatric health communities, doing so with warmth, respect, and clarity. We want this conversation to feel supportive and informative, much like a chat with a trusted doctor, wellness coach, or counselor who genuinely cares about your well-being. We believe that having accurate information helps dispel myths and allows each of us to make informed, confident choices about our own bodies and lives, free from judgment or pressure. As always, while we strive to provide helpful general insights, please remember that your health situation is unique. This conversation is never a substitute for personalized advice from your own doctor or healthcare provider. They know you best and are your most valuable resource for any personal health concerns. Life after 60 often unfolds with a unique beauty. There might be the quiet satisfaction of tending a garden, watching plants thrive under your care. Perhaps it's the irreplaceable joy found in the laughter and stories shared with grandchildren, bridging generations. Maybe you find purpose in volunteering your time and skills at the local community center, library, or hospital, feeling connected to those around you. Or perhaps it's the simple, profound pleasure of getting lost in a good book, pursuing a lifelong hobby, or enjoying the peace of a walk outdoors. These experiences enrich our lives immeasurably. Alongside these joys, our relationship with our primary physical selves continues. Our bodies naturally change, bringing new awareness and sometimes new questions. The topic of sexuality in later life is often shrouded in silence or misconception, leading many to wonder about what's normal, safe, or even beneficial: self-pleasure or masturbation. The private act of touching one's own body for pleasure, often leading to arousal and sometimes orgasm, is one aspect of this broader picture. You might have questions. Is it still okay? Is it safe? Does it offer any benefits? Are there risks? What do the people who study health and aging, the doctors, therapists, researchers, actually think about this? It's these questions we want to explore today, focusing on the perspectives of experts in senior health and wellness. What do experts generally say about masturbation in later life, the big picture? Let's start with the foundational view. Within the medical, psychological, and sexual health communities, there is a broad consensus on several key points regarding masturbation across the adult lifespan, including for older adults. It's generally considered normal and common. Experts recognize masturbation as a common and normal part of human sexuality for many individuals of all ages, genders, and relationship statuses. It's not viewed as deviant, immature, or inherently problematic. Many people masturbate throughout their lives, Others may start later in life, perhaps after losing a partner, while some may never have an interest. All these variations are considered within the range of normal human experience. It's generally considered safe physically. The historical myths that circulated for centuries, claiming masturbation causes blindness, weakness, insanity, infertility, or other serious ailments or schemersimus, have been thoroughly debunked by science. Experts confirm there is no medical evidence to support these fears. From a purely physical standpoint, for most healthy individuals, the act itself is benign. The potential for minor physical harm usually relates to being overly rough, causing irritation, or using unsafe objects, both of which are preventable with common sense. Age itself is not a reason to stop. There is no specific age at which experts say people should stop masturbating. The decision is entirely personal, based on individual desire, comfort, physical ability, and health status. Many people continue to enjoy self-pleasure well into their 70s, 80s, and even 90s. So, the baseline expert view is one of acceptance and normalcy, free from the judgment and misinformation of the past. But experts also delve deeper, looking at the potential ways this activity might intersect with health and well-being, both positively and in terms of necessary precautions. Expert insights, potential health and well-being connections. Health professionals who work with older adults often consider the potential benefits that comfortable, consensual sexual expression, including self-pleasure, might offer. These are not guarantees, but areas where positive links have been observed or are supported by physiological understanding. Stress reduction and relaxation. Experts widely acknowledge the powerful stress-relieving effects of orgasm. Life after 60 can bring significant stressors, health worries, financial concerns, loss, caregiving. Orgasm triggers the release of endorphins, natural mood boosters and pain relievers, and oxytocin, the bonding hormone that lowers the stress hormone cortisol. Doctors and therapists recognize this biochemical process as a natural mechanism for shifting the body from a state of tension, fight or flight, to one of deep relaxation, rest and digest. This can be a valuable medication-free tool for managing daily stress and anxiety. Think of it as your body's own built-in tranquilizer system. Improve sleep quality. Many sleep specialists and geriatricians are aware of the connection between orgasm and sleep. The profound relaxation combined with the post-orgasm release of the hormone prolactin, strongly associated with sleepiness, can make it easier for some individuals to fall asleep and potentially stay asleep. Given how common sleep disturbances are in later life, experts view this potential benefit positively, seeing it as a possible natural alternative or supplement to other sleep-promoting strategies. Mood enhancement. Psychologists and therapists recognize the mood-boosting potential. The release of endorphins and dopamine, the pleasure and reward chemical, can provide a temporary lift, combating feelings of low mood, sadness, loneliness. In the context of potential isolation or loss often faced by seniors, experts see value in accessible, self-generated sources of positive feeling and pleasure. Pain management. While not a primary pain treatment, pain specialists and doctors acknowledge the analgesic pain-relieving effect of endorphins released during orgasm. For some seniors managing chronic pain like arthritis, the temporary relief following orgasm can be a welcome side effect, offering a short break from discomfort. Pelvic floor health. Women gynecologists and physical therapists specializing in pelvic health note that the involuntary rhythmic contractions of the pelvic floor muscles during orgasm act as a form of exercise for these muscles. Maintaining pelvic floor tone is crucial for bladder control and preventing pelvic organ prolapse. Common concerns for older women. Experts see orgasm as a natural, complementary way to help keep these muscles active. Prostate health. Men, urologists, and researchers are aware of studies suggesting a potential correlation between higher ejaculation frequency and a lower risk of prostate cancer diagnosis later in life. The prostate flushing hypothesis suggests Regular ejaculation might help clear potentially harmful substances. However, experts are cautious here, emphasizing this is an association, not proven causation. Other lifestyle factors might be involved. It does not replace the need for regular prostate cancer screening (prostate tests, DREs). It should not be viewed as a guaranteed prevention strategy. It's considered an interesting area of research, potentially offering a small added benefit for those who are already sexually active, but not a reason to force activity. Body image and self-acceptance. Psychologists and counselors often see self-pleasure as a potential tool for fostering a more positive body image, especially when navigating age-related physical changes. Focusing on internal sensation and the body's capacity for pleasure, rather than solely on appearance, can enhance self-acceptance and counteract negative societal messages about aging bodies. Experts view this reconnection with the physical self positively. Maintaining sexual function. Use it or lose it can apply to some extent to sexual function. Experts suggest that regular sexual activity, partnered or solo, helps maintain blood flow to the genitals and keeps tissues more responsive. For men, regular erections may help preserve erectile tissue health. For women, stimulation can promote blood flow, which may help counteract some effects of vaginal atrophy. Cognitive benefits. Indirect, while not a direct brain exercise. Experts recognize that factors improved by self-pleasure, reduced stress, better sleep, improved mood, are all crucial for optimal cognitive function. By mitigating these negative influences, it might indirectly support mental sharpness. Expert views on safety, adaptation, and when to be cautious. While generally positive or neutral, experts also provide crucial guidance on safety, adaptation, and situations requiring caution. Cardiovascular safety cardiologists generally agree that for most people with stable heart conditions or no known heart disease, the exertion of sexual activity, including masturbation, is safe, comparable to mild, moderate exercise like climbing stairs. However, for individuals with severe, unstable, or uncontrolled heart conditions, experts uniformly stress the absolute necessity of consulting their doctor before resuming any sexual activity due to the potential risks associated with temporary increases in heart rate and blood pressure. Safety first is the expert mantra here. Importance of lubrication, especially women. Gynecologists and geriatric health experts strongly emphasize the use of lubricants for postmenopausal women due to estrogen decline causing vaginal dryness and thinning. They view lubrication not as optional, but often as essential for preventing pain, irritation, and micro tears, ensuring comfort and safety. This is standard medical advice for managing genitourinary syndrome of menopause (GSM), adapting to physical limitations. Experts encourage adaptation rather than cessation when physical challenges arise. Occupational therapists, physical therapists, and doctors advise experimenting with positions, finding comfortable ways to accommodate arthritis, back pain, or mobility issues. G. Side lying, using pillows for support. Using assistive devices, recommending vibrators or massagers with ergonomic designs for those with hand dexterity issues or limited reach. Focusing on accessible areas, reminding individuals that pleasure isn't solely genital. Listening to the body. A core principle stressed by all health experts is mindfulness and listening to bodily signals. Pain means stop or adjust. Gentleness is key, especially with delicate older tissues. Managing medication side effects. Doctors advise patients experiencing sexual side effects from vital medications, G, for blood pressure, depression, to discuss the issue rather than stopping medication. Experts aim to find solutions, perhaps by adjusting dosage, switching drugs, or treating the side effect, balancing overall health with quality of life. When to seek medical evaluation. Experts advise seeking medical attention if self-pleasure causes persistent pain, bleeding, or occurs alongside other concerning symptoms like urinary changes. This ensures any underlying infections, skin conditions, or other medical issues are diagnosed and treated. Emotional well-being. Mental health professionals emphasize that if masturbation causes significant guilt, shame, or distress due to personal values or trauma, forcing it is counterproductive. Honoring one's emotional boundaries is crucial. Therapy can be helpful if one wants to work through conflicting feelings. The role of healthcare providers. Open communication. A consistent theme from experts across disciplines is the importance of open communication between older adults and their healthcare providers. Doctors, nurse practitioners, therapists, and specialists are increasingly recognizing sexual health as an integral part of overall health and quality of life at all ages. Experts encourage seniors to not be embarrassed. Healthcare providers are trained professionals who discuss sensitive topics regularly. Ask questions about safety related to health conditions, medication effects, pain, dryness, changes in function. Report symptoms. Don't ignore pain or discomfort. Seek solutions. Providers can offer evidence-based advice. Recommend lubricants or treatments like vaginal estrogen or ED medications where appropriate. Adjust medications or make referrals. Experts see themselves as partners in helping seniors maintain their health and well-being. And that includes addressing concerns related to intimacy and sexual function respectfully and knowledgeably. Synthesizing the expert perspective, a balanced view. So, what is the overall expert view? It's balanced, nuanced, and grounded in science and compassion. Masturbation is generally recognized as a normal, common, and physically safe activity for most older adults. Age itself is not a barrier. It holds the potential for real psychological and physical benefits related to stress relief, sleep, mood, pain perception, and potentially pelvic/prostate health, largely due to the beneficial hormones released during orgasm. Adaptation is often key to maintaining comfort and safety as bodies change. GD. Using lubricants. Finding comfortable positions. Caution and medical consultation are essential in specific situations, particularly involving severe unstable heart conditions, recent surgery, or persistent pain. Personal choice, comfort, and values are paramount. There is no should or should not. Experts support informed, autonomous decisions. Open communication with healthcare providers is encouraged to address concerns and find solutions. Experts view self-pleasure not as something taboo or problematic, but as one potential aspect of a healthy, fulfilling later life for those who choose it. A private way to experience pleasure, comfort, stress relief, and connection with one's own body. It's seen as part of a holistic approach to well-being, complementing other healthy habits like good nutrition, exercise, social connection, and managing medical conditions. Think of it like gardening. Experts agree gardening is generally healthy exercise, fresh air, stress relief, but they'd also advise using proper tools, not overdoing it if you have back pain, protecting yourself from the sun, and maybe that adapting with raised beds as you age. It requires common sense and adaptation. The expert view on masturbation is similar, generally healthy, potentially beneficial, but requiring awareness, adaptation, and specific precautions where needed. Your life, your choice, your well-being. Understanding the perspectives of health experts can help demystify the topic of masturbation in later life, replacing outdated myths with factual information and reassuring guidance. It affirms that pleasure and intimacy, in various forms, don't have an expiration date. It empowers you to make choices that feel right for you, aligned with your desires, your values, and your unique health circumstances. Whether self-pleasure is part of your life or not, knowing that experts view it as a generally normal and safe option for many seniors can contribute to a broader sense of acceptance and freedom regarding sexuality and aging. It supports the deeply held values of personal dignity, autonomy, and the pursuit of a fulfilling life at every stage. Thank you for joining us at Golden Vitality for this open and respectful exploration of expert views on masturbation for older adults. We hope this conversation has provided clarity, comfort, and valuable information to help you feel empowered in your health journey. Remember, your experiences and choices are valid. Listen to your body, honor your feelings, and never hesitate to reach out to your trusted healthcare provider with any personal questions or concerns. They are your best partners in navigating your path to continued health, happiness, and vitality. Take wonderful care of yourself, stay informed, and continue to embrace all the richness life has to offer. Be well.